So this story comes from NPR.org or just NPR. I didn't have to say the .org. How many transgender teens in the U.S. are receiving medical care related to gender transitions? According to a peer-reviewed research letter published Monday.
Is it a lot?
It is not. It's very, very few, Cecil. And in fact, they have a number. So I want to actually go into the article here and tell you what the number is. Because for all of the fucking hand-wringing and the crying and the screaming, when they look at insurance claims, that's the data that they used, from 2018 to 2022, so over a 4-year period, there were less than 1,000 youth over the course of 4 years that accessed puberty blockers, and less than 2,000 that ever had access to hormones. That is less than 0.1% of teenagers with private insurance that are transgender.
That's a 4-year period?
Over a 4-year period.
Wow, man.
Yeah. So when we talk about, like, when these conversations are had, I think a lot of times these conversations are had in a vacuum, in a sort of like hypothetical space. Because if we talk about them in the practical space with numbers, this is a non-issue.
Yeah.
Right? So numerically, in a country with I don't remember how many people are here, like 370 plus million people, we don't ever talk about public policy that affects 1,000 people. Right? It's not meaningful to affect 1,000 or 2,000 people because it would actually not qualify to be public policy. So these conversations are always had absent those whole numbers because we have them in the hypothetical as if to suggest that this is a problem of scope and scale.
Yeah. It's a widespread thing that's happening. Every single school is having to deal with this. Every single counselor at school has to talk parents down from doing something like this, et cetera, et cetera. You hear all these, they try to make it into, it's ubiquitous that we're creating an entire youth that is going to be using these products. We're changing how puberty works for wide swaths of the young people in this country when in fact you're not at all. You're not doing that at all. What you're doing is like you say, 1,000 people. It's a tiny, tiny sliver of people. And the thing is that doesn't serve the hysteria.
Yes, exactly.
If they just said something that was like, oh yeah, it's happening in like, over a 4-year period in the tiniest amount of places, that doesn't serve what they want, which is to erase trans people. That's what they want. They want to erase trans people. And the way they can do it is to, again, like we talked about earlier, think about the children. But when you consider all the factors, it's almost like non-existent. There's a tiny, tiny, tiny sliver of the population here that we're talking about, but it doesn't serve your hysteria if you go with the actual numbers. So that's why they conveniently ignore them all the time.
There's a difference between has it happened and is it happening? Right? Yeah. We should have public policy conversations about things that are happening and not something that has happened. It really is the same thing that they do when they say, hey, this one immigrant committed a murder.
Yeah.
And you say, okay, well, statistically speaking, actually, people who are migrants are less likely to commit any kind of violent crime, right? It's a crime in general, but specifically violent crime. They're actually significantly safer to have around you than a United States citizen. And what they'll do when that happens is they'll say, but tell that to the family of dead so-and-so. One person is too many. So what they'll do is they'll have disingenuous conversations in order to make something that happened become something happening.
Yeah.
But we don't want to do that. That's bad. That's bad thinking when it comes to public policy, when we come to lawmaking, when we come to social choices. We need to think more broadly. Of course we do. And so we need to think about what is happening, not what has happened. They intentionally invert those arguments. And it's very confusing. If you ever had a conversation with somebody like that and they say, well, one murder is too many. You're like, okay, like I do actually think every murder is bad. Of course, what kind of person wouldn't think that? But like also I recognize that we make public policy choices that are complex and balanced and based on the good of the whole. That I understand how trolley problems work. These guys intentionally don't want you to think about it.
Yeah. What they want to do is they want to load that trolley problem on one thing to get you to think about one thing. So they're loading the tracks very quickly so that they hope you don't notice that the other side is clear.
Yeah. Yeah. I had an immigration conversation, Cecil, you might enjoy. I had an immigration conversation with a doctor the other day. So there's a doctor of mine that I've gotten friendly with, and he's kind of middle right, you know? He's not hard right. He's not MAGA right, but he's middle right. And, you know, he and I were having a chit chat about immigration. And he feels, I think, fairly torn about, he thinks we're spending too much. And this is not borne out by the numbers, but like he thinks we're spending too much money providing social and other services to immigrants. Now that's nonsense. We know that's nonsense.
We don't do that.
Right.
Yeah.
So I swim upstream on that. But it was actually more successful for me to say, look, if tomorrow Trump got his way and deported, let's say just as a thought experiment, let's say he deported 50% of all the undocumented migrant workers in the United States. I was like, your life would get immediately more expensive. Like immediately. If all those people stay here, it stays the same. What scenario do you envision where your life gets less expensive? Because your argument is an economics argument, right? So he's saying like we're spending too much money. I'm saying even if I grant it, if everybody, if we were to find and round them up and put them in camps to do like all of a sudden everything, and he concedes everything would become more expensive.
Sure.
And there's really only more expensive or stays the same. There is not, we saved money. There's no argument there. And that actually was effective. That argument was actually effective with him. Because rather than trying to like dig up a whole bunch of facts that he could dig up himself, it was just like, look, that you've only got two, the equation doesn't balance out ever where you get more money in your pocket.
Yep.
And that actually was an effective argument. Like he was like, yeah, okay, I actually see that point. And I actually like think he may have changed his mind.
Wow.
I think.
Wow.
I think. We'll see next time I see him in 6 months.